Hi there. This is an analogy to explain how Hoover's sign can be used to differentiate organic from non-organic leg weakness. Hoover's sign relies on the principles of synergistic contraction, which is a normal phenomenon seen in many paired muscle groups. An example of this is where if one leg flexes, the other extends automatically. It is likely we have this mechanism to help actively maintain balance, where an example might be if you accidentally step on a sharp object, the hurt leg will automatically flex so it's not stepping on the sharp object anymore, but to prevent you from falling over, the other leg will automatically extend to keep you upright. To illustrate this concept, we will use a compass on its side, which signifies a person laying on their back as seen in the bottom right corner. The compass blades represent the legs, where the upper blade represents the flexed leg and the lower blade represents the extended leg. The interlocking gears represent synergistic contraction, where the action of one leg influences the other. The red handle signifies the body's center of mass. If you have no leg weakness and flex your right leg, the left leg will extend proportionally to the synergistic contraction, shown by both blades moving equally apart from each other due to their interlocking gears. The opposite is also true. If you try to actively extend one leg, the other will flex automatically. The red handle has not shifted, showing that the center of mass has not moved. Let's now imagine we have someone who has organic right leg weakness. The reported weak leg is signified by the blade being lighter in color with a wooden block attached to it. If you ask them to lift their weak leg, they will not be able to, but the opposite good leg will extend automatically. This is done in an unsuccessful attempt to use synergistic contraction to lift the weak leg up. This shows that the patient is really trying to lift their weak leg up. If we have the same patient, but this time ask them to lift their good leg up against resistance, symbolized by the weight, the patient's weak right leg will not be able to extend using synergistic contraction. This confirms that the reported weak leg's hip extensors are actually weak. The nice thing about Hoover's sign is that its interpretation relies on you focusing on what is happening to the opposite leg to that which you are telling the patient to focus on. Although not shown, when performing Hoover's sign, the clinician stands at the end of the bed with their hands around the patient's ankles. This allows the clinician to add resistance if needed, and to also check if appropriate extension of the opposite leg is occurring. Let's imagine another patient who has non-organic right leg weakness. Again, the reported weak leg is signified by the blade being light in color with a wooden block attached to it. If you ask them to lift their weak leg, they will not be able to, but this time the opposite good leg does not extend automatically. This is because there is no attempt to use synergistic contraction to help flex the weak leg, and so both legs stay in place, which is shown by no movement occurring. If we have the same patient, but this time we draw their focus to lift their good leg up against resistance, the reported weak leg will automatically extend via synergistic contraction, which means that the reported weak leg's hip extensors are working normally and there is no organic pathology. In summary, side by side, the left side represents organic leg weakness and the right represents non-organic leg weakness. If you ask both these patients to lift their weak leg, they will not be able to. But the patient with organic leg weakness is attempting to use synergistic muscle contraction as shown by the opposite leg extending in an attempt to lift their weak leg up. In contrast to the patient with non-organic leg weakness that will have no synergistic contraction and so little or no extension occurs in the opposite leg. If you then ask both these patients to lift their good leg up against resistance, they will both be able to, but the patient with organic leg weakness will not be able to extend their weak leg as it is actually weak, which is in contrast to the patient with non-organic leg weakness who will be able to extend their reported weak leg proportionally to the effort from the good flex leg, which is also the same picture seen in a normal person with no leg weakness. Again, the focus of the examiner should be on the leg opposite to that being tested, so while you are asking the patient to flex their leg, you are focusing on the other leg for any signs of extension.